We could provide education, helpful support, and all that. So in addition to this, the digital solution idea, is there anything else outside of the app that could potentially, that you could think of, help capture that patient in the ER room? And it's probably the most challenging population, right? Because they don't in the healthcare system.
Yeah, no, I know. I'm listening to your description there and thinking, so we've got someone that probably doesn't pay for their own insurance and therefore doesn't mind going to the ER all the time because, hey, they're not paying for it. And they're not motivated, proactive. So, if that's the case, is that what we're describing? I mean, I don't want to, paint them as bad people, but giving a little more understanding of what the challenges are with the motivation to behavioral change here. Is it they don't have insurance and they come into ER and they're not paying for it, they're unemployed or underemployed, or do you know?
I think it's a combination of things. So I think the falling out of the system for a lot of these patients is happening at the period when they transition from pediatric to adult care. Because pediatric care is very well established in the U.S. and also in ex-U.S. countries. That's where they have their full care group. It's your pediatric, more of a loving environment. They go there all the time. Everyone knows them. Nobody questions whether or not they're in pain. They're believed. They have their caregivers. They fill in their parents' insurance at that time. Once they transition from pediatric to adult, we hear it's more hearing from same inpatient words. They describe it more of a drop and versus transition. And even if the transition period is well established, and sometimes it takes 2 to 3 years to for the pediatric care to kind of infuse the patients with information and introduced to those adult caregivers. Still, as they show up in the adult ward, they're not with other children or pediatric or sickle cell disease patients. They're among some adult patients with cancer. They're not treated the same way. So that's one of the issues, right? There's disillusion. There's disconnect and disbelief in the healthcare system at this moment. They don't have their regular specialist that was with them, for their whole life. Now you also have a shortage of adult sickle cell disease treaters. It's not a very attractive field, as of this time for multiple reasons. And one being that there's not, a lot of treatment options there. The patient population is mostly in Medicare and Medicaid. So, slowly the interaction between the patient, I think, and the healthcare system creates this divide and mistrust for a lot of them. So they try to manage pain at home as much as possible so they don't have to go to the ER. They view ER as a last resort. Except for those that could potentially have, opioid issues, because there is a percentage of those patients as well. We can't deny it. But a patient that is not, opioid dependent, that, wants to manage the pain crisis at home will not go to ER unless it's probably past day 4. Those crises are very long and intense. And they go to at that point, they're probably just in such intense pain that they're looking for medication, right away. And that could be a patient that is involved with their, healthcare provider as well. They could do the same thing. They could have a protocol, manage pain at home, and only go to ER in extreme situation where they can't manage it anymore. But it also could be that patient that doesn't believe in the healthcare system, doesn't necessarily take their medication. As of now, it's only hydroxyurea that has been approved, and L-glutamine, which is more of like a supplement, has been approved lately in the U.S. So they tend to manage the acute, pain crisis by going to the ER and then falling out.